George Kilpatrick Inspiration for the Nation, celebrating people we feel good about. September is Suicide Prevention Awareness Month, and we have some alarming statistics, I think, to share with you, but more importantly, what we can do about it. We're pleased to be joined by Dr. Sunny Aslam. He is an addiction psychiatrist with Syracuse Community Health. And Dr. Aslam, welcome to the program. Good to see you.
Thanks for having me.
Recent data shows that Onondaga County's suicide rate is sitting around 10 to 11 per 100,000, which is higher than the state average. And then the other troubling statistic is that among various demographic groups, Black and brown youth are showing the highest rates of suicide increase over the last few years. So with that being said, we want to tackle all of that. And it's funny to us today, before this conversation, I just got in my inbox something from this group. I forgot the name of the group, but I'm checking it now, that really said, what's the name of Word in Black Health, 3 ways to prevent suicide death. So this is a timely topic. And so let's talk about why the rate in Onondaga County is much higher than the state average, a little bit higher. And what are you seeing on the ground at Syracuse Community Health that helps to explain that gap?
Yeah, it's a very important question. So what we see may not shock people, but it's for families that have been traumatized and experienced discrimination, economic barriers to care. I mean, it's a familiar refrain, but it's one that we're always trying to fight against at the health center. We're trying to provide access. We have walk-in availability for care. So we're always trying to tackle all these barriers and get people into treatment.
Yeah, it's very interesting. You said you're trying to get people in the treatment. Are there unmet needs, particularly in Black and brown communities, that you're noticing?
Yes, I mean the simple answer is yes. Those factors I just mentioned are just, I mean, just some of the problems. People have problems with transportation. They have children to take care of. They have families to take care of. They have jobs. Some of my patients work multiple jobs.
Mm-hmm.
And so I had someone come in today and saying, I need to get back to work. I've been having some mental health problems, but I need to get back to work. And of course, we want to do everything we can to help people get back to work, but in a healthy way. So again, we're just trying to provide treatment, whether it's therapy. Some people want medication, some people want therapy, whether it's individual psychotherapy or group treatments. We're in the schools, so the health center has made a big commitment to be in the city schools. So we have therapists in the local schools as well, just so that there are multiple ways, not only for the children to get the help, but their families to get support they need. Maybe mom needs a therapist. Maybe dad's depressed and wants some help with maybe drinking. We do addiction treatment as well. These are all the things we try to raise awareness of and say, we're here, we're available. Please come in and see us, and we'll try to get you the help you need.
Let me get colloquial with you, Dr. Aslam. A lot of folks are under the impression that suicide is a white folks problem and not a problem in our community. And of course, the escalating rates in communities of color in particular don't bear that out. So how do we deal with that?
Yeah, so to me, it's all about engagement. And so we just try to talk to anybody and everybody who will listen about what's going on, whether it's our local politicians, public health officials, people at the county. I mean, I've been in town 18 years working with the poorest of the sick and the sickest of the poor. And what I realized is I can't sit in my office and think I'm going to make enough of a difference. And so I've had to learn how to advocate, get out in the community, get a little political, which means talking to local politicians, whether they're Republicans or Democrats. Representative Katko used to be great about meeting to talk about mental health issues. Not to be, partisan, but you have to get a little political if you want to get people to help with funding, with just raising awareness, just so that conversation happens. Because there's this I think, misunderstanding out there that if you should never talk about suicide or someone's going to be at higher risk. That's not true, actually. You want to engage people who have warning signs like depression, anger, rage, behavioral outbursts. People show you their distress in different ways, and we want to try to engage people to have conversations about what's going on and how we might be able to help.
We saw through some of the services that provide suicide prevention support, hundreds of youth crisis text chat conversations in Onondaga County last year with a handful of rescues. What are some of the early warning signs that parents, coaches, faith leaders, teachers should watch out for? And what's the best first step when a teen opens up?
Great question. So we want to look for any signs of emotional distress, and that can come out in any number of ways. It can be tantrums, it can be physical aggression, it can be verbal aggression, it can be low mood, it can be disengagement. Maybe maybe a child was really interested in basketball and suddenly just doesn't care anymore, disengaged, not speaking. So and there are all kinds of signs, but if you notice a friend, relative, somebody you care about suddenly just changing in ways that worry you, yeah, we say don't suffer in silence. We don't want the child or whoever it is, whether they're an adult or child, to suffer in silence. And so we try to bring up the issue, ask what's going on. Would you like to talk to somebody? These days, social media can cut both ways, right? It can be something that can be very difficult for children with bullying and looking for affirmations and likes and things like that. But at the same time, there are efforts to engage social media in ways that try to help kids and adults to get to treatment if need be. So there's a number of different things and ways people show distress. And then the first best step is for a loved one, a faith leader, maybe someone from your church or someone from your school, a teacher that cares, somebody noticing and engaging the child, adolescent, or adult, and saying, "Hey, do you want to talk? Is there anything you need? What's going on? We've noticed a change."
It's interesting you say that, and yet it seems that our communication has become more isolated, right? Because of this thing, right? And so, are we even equipped to even have those kinds of conversations when my perception is that there's a generation that would prefer to do this than to actually talk to you?
No, again, you're making an important point. And so, I mean, I'll admit I struggle with this in my own family. I come home from work exhausted, right? And my kiddo wants to be on her phone and play with her friends all night. But we have to set limits around it. Our chores done, his homework done. We're shutting it off at 8. We're going to spend time as a family at dinner. We're going to watch a movie together. And it's not easy because I could just collapse on the couch for the night.
Right.
And I think for a lot of parents, I hear the same thing that, I hear the screens aren't necessarily good for the kids, but man, I need a break for an hour or two. And it's an easy way to do it. So I think the realistic thing, and again, I'll admit it in my own life, is sure, my kiddos are on their phones sometimes, but I really try to engage them to get off there too. Let's go out and throw the softball around or whatever. But it's a challenge. I'll
Yeah,
absolutely.
and where I was going with that is, so yeah, the device is one thing, but I'm saying if we're so tethered to those devices, how the communication about checking in and things of that nature becomes that much harder because I'm not used to doing that way, right?
Right. Yeah. So it takes practice, and practice makes perfect, or whatever you want to say. But, it's about trying to have those conversations, particularly if you see some signs of distress, disengagement, big changes in grades, in relationships. Suddenly, Jim doesn't want to hang out with his best friend anymore. And you're like, that's weird. What's going on here? Can we talk about this?
You talked about some of the barriers uh, to treatment or access to support services, but I'm still. Can I just ask this question again? Why are suicide rates nationally up nearly a third or over a third, particularly amongst Black and Brown youth?
Yeah, I mean, I think you noted this, George. They're up across the board, and but the most distressing thing, one of the most, is with Black youth, right? Ages 10 to 17 has gone up significantly in Black and Brown youth, and I don't know that I have a great answer specifically why it's happening in that group, because I don't know from where I sit and having again worked for 18 years in town with really poor folks. I mean, things seem just as horrible as they've always been, that people are just, we talked about this the last time we met, right? We have the number one city for child poverty in the country, period. And so people are experiencing tremendous poverty. And then you add in the trauma, the violence, drugs and alcohol, all those things. And we just happen to live in one of the poorest cities in the country. And I think that amongst other reasons just is taking a intergenerational toll.
We should note that suicide rates are highest among whites, and for those who are choosing uh, self harm, the presence of a gun seems to be the most prevalent way. But that's not all the necessarily the case across demographics. And so, what do we do about that?
So the only thing I know is education, awareness, engagement, and treatment. I do speak to any group that will have me. I engage with other local groups like NAMI Syracuse. Assemblywoman Pam Hunter is having a roundtable soon. So I try to put myself out there as someone who's concerned about local public health, particularly in the most underserved, vulnerable communities, so that as a physician, I can try to and I there's that stigma, right? The stigma is that particularly with many people of color in India, we don't talk about these issues. The Black community, I think, is similar to that from what's been shared with me. And so having those conversations and then telling people I've been in therapy. I remember, George, the year after I graduated from my residency program at Upstate, I was running a group at over at Hutchings Psychiatric Center. And I shared with the group that I was in therapy. And I remember people's jaw just dropped. They assume because you're the doctor, your life is perfect. And, no, like therapy has been hugely helpful for me. And the only reason I bring that up is not because it's about me, but just to break down that stigma that people of all shapes, colors, wealth, educations suffer with anxiety, depression, and can benefit from therapy. And I just think if I share that, sometimes people might be a little more willing to ask for help if they see the doctor, himself gets help.
Dr. Sunny Aslam, of course, addiction psychiatrist with Syracuse Community Health. Since you talked about getting help, let me put this number out here right now. You can call or text 988. That's the Suicide and Crisis Lifeline, where help is available 24/7. And when you think about some of these, obviously one of the issues that I ran into doing research for the show is that we don't have good data, especially amongst the demographic groups, Black and Brown, really good data anyway for Onondaga County. So how can we improve that?
So I think engaging the county around that could be helpful. Like there are really caring public health officials over there. Dr. Anderson is our public health commissioner locally. She's very engaged, very active. She's someone we could talk to about that, as well as the mental health division over there. There's very active staff who care deeply. I've been many meetings with them and had these same conversations. And maybe it's just another conversation to ask about the demographic data, and if it's not being collected, could we collect it and maybe promote it more?
What about reducing access to things that create high risk, like firearms or medications? Are there reduction steps that people can take in their homes so that it's not as accessible?
Absolutely. So, some of these are political issues, which have been very difficult to tackle, but still people on an individual basis can lock up weapons, get gun locks. If and when people are distressed in the family, we often ask, could you just get the guns out of the house until things settle down? Would you give it to a relative? Could you, that we want to try to lower the risk factors. We call them the dynamic risk factors. for suicide can have static risk factors that we can't change, like my age, my ethnicity, et cetera. But then there are dynamic factors we can address, like depression, substance use, presence of weapons, et cetera. And so we try to tackle all those dynamic risk factors, and offer treatment options and processes that will make people safer, locking up medications, locking up guns, or getting them out of the house, et cetera.
Yeah, you mentioned this earlier, but are there particular strategies that work best in our communities?
So I think one of the biggest challenges we have is my patients come in and say, I want a Black therapist. And
Mm.
although we have some around, we just don't have enough. So if there's, for people who are looking for jobs or thinking about a career, if you want to be a therapist, you will never be short of patients. If you're African American, you want to be a therapist. Let me tell you, this is one of the difficult things about my job is I just can't get everybody who wants a Black therapist to a Black therapist, and because we know that psychotherapy, that process of talk therapy between two people, or it can be group therapy as well. Those are two of the most effective ways to treat depression and to treat suicidality. They are very effective. So we just need to get people to them, and people want to talk to their own people. I get it. It's a reasonable request, and we try to fill it any way we can. I got a request from someone in my own family this week who said, I want a Black therapist. And so what I did was I looked up. You can Google, depending on your insurance. There's a publication called Psychology Today, and they will actually help you filter by ethnicity. So you can put in like Excelis Insurance, African American woman therapist, man therapist. So that you can help. And then you can see locally, I mean, we still do have several, but not all of them are taking new patients because they're so overwhelmed with the need.
We had yesterday in Syracuse the Black Male Mental Health Summit, which obviously is there to help support uh, what Black men are going through in this community. We need more of those kinds of things, I think you would say.
Absolutely. And it might help if we could put one together where if you help MC and promote it, we might get a lot of people there, and I'd be happy to work on that with you, and we, use the health center resources if that's helpful too.
Let's do something like that. I mean, I know, like I said, they had one yesterday. That was at the Syracuse not community connections. The other one at Syracuse Community Connections. Um, are there? We talk about risk factors. Are there protective factors, things that would help reduce risks that are underutilized?
Absolutely. So, particularly in the Black community, like faith, family, and friends, we say the three F's, like those can make a big difference. Like sometimes for some kids, they'll tell you it's one teacher at school, it's an uncle, it's a basketball coach, it's a baseball coach. Often there's, maybe one person that can make a big difference in someone's life. I mean, I'll tell you personally, I had a teacher, my sixth grade teacher. She was so good to me during a tough time in my life. My baseball coach, so it really can be. When I was going through my divorce, it was the pastor at my church. Like it's often we have resources around us that we forget. I will say there are free 12-step groups, and 12-step groups were originally founded like Alcoholics Anonymous based on alcoholism or addiction. But there are 12-step groups for everything these days.
Mm.
And I refer people to them because they're free. And with one of the nice things that came out of the pandemic is everything has virtual options now. So now people can go to a 12-step group for free almost all day, every day. And I think it's really underutilized as a resource, particularly in the African American community. There's the Black Emotional and Mental Health Collective. There's Black therapy for Black girls. There are some specific groups that are out there and kind of building their presence to try to break down the stigma and offer treatment options as well.
What about and I didn't mean to not get to this group sooner, but we know that suicide rates for LGBTQ plus youth are also high, and that's because of a lot of factors. Can you speak to that?
That's a tough one. I mean, I found particularly in the past 5 years a lot of gay and transgender patients coming to me, and they're deeply in distress. They feel, particularly the transgender patients, just feel rejected, hated, cast away. And sometimes they are. I mean, some of these have been homeless youth. I mean, children that are let out of their family and turned away from the family because they were, this stuff is it's biological. It's not a choice. Some people believe this is some kind of choice, but it's not. And so we just try to offer whatever supports we can to them. But often it's things like housing, which sounds crazy, but there's a lot of very heartbreaking stories that I hear from people who, and a lot of fear around even revealing these things these days because of political reasons and social and cultural reasons too.
Right. So you mentioned the faith communities, right? Which is the main source of rejection for a lot of LGBTQ plus youth, their families first, because the church and the families wants the sin, quote unquote, to be prayed out of them, right? And so, what's your message to faith leaders around their members who may be gay, lesbian, or trans?
Yeah, I think it's a tough one. I mean, I just try to lead by example, like, whether you're Muslim or Jewish, Christian, I mean, you try to love the person no matter what their choices are, and I try to talk about these issues. And it's not all faith groups. I engage with a number of groups, church groups, Catholic, Christian, Unitarian Universalists locally who are very supportive of LGBTQ. Pastor Eric Jackson was he left the Plymouth Congregational Church. He
Plymouth
was our pastor for
congregation.
years, very active, and he would have other Black pastors come in and speak about this issue as well. So I think there are churches that are very
But
progressive on these issues, and so I just don't want to paint it with one stroke. But in general,
well,
yes, there's yeah,
well, let
yeah.
me paint the stroke for you then. So those churches that you mentioned and the pastors that you mentioned is one thing. I'm talking about the main line. You know what I'm talking about. Black core, black churches are predominantly black. Let's say it that way, because the preachers will tell you God has no color, whatever. But I'm talking about because the churches you mentioned and the examples you gave aren't necessarily what your patients may be experiencing. So, how I need you to come back to that again.
Absolutely. So, I mean, I think the message has to be maybe it's a discussion. I don't know,
Mm-hmm.
but I don't understand it. If you're if you're a faith, a clergy person, and you're speaking about your hatred or your dislike of LGBTQ people, I just don't understand how that can be. I mean, you can have differences in um, religious or theological um, ideas, but you definitely have people in your church who are LGBTQ, and they're probably not telling you that they're scared. They don't want to be cast out. Those things don't sound very Christian to me, you know. So I think that I, Marlon Wayans is one of my favorite comedians, and he really dedicates his life to this because he has a LGBTQ child, right? And I find it very moving, that he speaks out in the way he does. And I guess more people just need to speak out and say, I mean, you're really harming people when human beings, people who are just like me and you, they just were born a little differently, and you're choosing to, and we're talking about suicide here. I mean, these are people who kill themselves, and
Yeah.
some who are attacked, and people may use some of what's said in church as justification for violence
Yeah.
towards LGBTQ people,
Right.
uh, for hatred, for violence, and we might not like it when other people do it, right? When other colors, other ethnicities say these things, but when it's happening in our community or the people of color, the Black community, the Indian community, it is all very upsetting and distressing, and it really needs to stop. People need to realize that I mean, I don't even know, what do you even say? Like
Right,
these are
right.
human beings. Like
I want you to call them out and say, "This is what we got to do." That's what I want you to say.
yeah, you're absolutely right. I mean, there's no room for hate in churches, and that's really all there is to it. I mean, please
So,
stop.
what would be your three? So this thing that I was sent, Dr. Aslam said these three things is what we can do, and I want you to add to that or say that's it. We good in terms of suicide prevention. The three things that this thing that was sent to me today, ironically, said know the warning signs. What you said, pay attention to shifts in mood. You said that already. Uh, you withdraw from family, isolation, talk of hopelessness or risky behavior. Then the second one was engage in the community. Isolation fuels despair. Checking in. You talked about that, right? Just a review. Um, Checking in on friends and loved ones, especially young people and elders, can create a sense of community and protects against suicide. And then the third thing it says was support health equity initiatives, support initiatives that expand access to affordable, culturally competent mental health services, which you said already again, from advocating for more Black therapists, which you just said, to backing school-based programs because equity saves lives. So you done covered all of that, but would there be anything that you would want to give listeners right now that they can, any additional steps that they could use right now?
So the two things that came to mind were, and maybe it's already covered, but treatment should include addiction treatment. So addiction treatment, particularly alcohol. Alcohol is one of those just like X factors. That if you're already depressed and then maybe you were having some suicidal thoughts or something, and then you're drinking, you basically have increased your risk so much, that so like addiction treatment is something that's really important. Treatment so cannabis is now legal, right? Marijuana is legal, but marijuana is actually associated with, particularly the younger the user, with the risk factors of increasing anxiety and depression. So often, what people experience is when they inhale and they become inebriated, they feel more relaxed, but they get rebound anxiety, rebound depression. And when they come in to see me, they smell like cannabis. So I bring it up and just ask them, "Do you feel like you're addicted? Is this a problem?" "Oh no," they say, "but you're telling me at the same time you're badly depressed." So we try to have these conversations about alcohol, drug use, and how alcohol is a major central nervous system depressant, as well. So we need to be actively treating addiction, as well. And then I would just ask that if this is an important issue to you, and I hope it is out there, your listeners, maybe you want to join an organization. Maybe you want to support a local group that works on mental health issues or suicide. NAMI Syracuse is one. Maybe there's another group that is more important to you. Maybe you've got a few extra dollars and you want to donate it to the health center or other organizations that provide health, but engaging in the community, talking to local politicians and just letting them know. Maybe you write a letter and just say, "This is really important. We really need more funding so there's more access to treatment." Maybe you have money to fund a scholarship for African American therapists to help somebody who wants to be a therapist but is really looking at the tuition and is saying, "Oh gosh," But those are a few things that.
Well, if you or someone you know is struggling, call or text 988, the Suicide and Crisis Lifeline, anytime. Help is available. You're not alone. And the Syracuse Community Health is your community based support system with culturally competent, culturally responsive health support for you. 315-476-7921. They're located 930 South Salina Street in Syracuse. Dr. Sunny Aslam is an addiction psychiatrist with Syracuse Community Health, our partner here at Inspiration for the Nation. And Sunny has given us a challenge to do more in this area where we host a panel and have a conversation of how this is happening in our community. So that's our challenge. And so we are now committed to making sure that we get that done. So stay tuned because Sunny has put it out there. That's how we make a difference. Dr. Sunny Aslam, Syracuse Community Health psychiatrist. Call them as well as the suicide prevention hotline. The community is here for you. That hotline, text 988 or call 988 or call the Syracuse Community Health 315-476-7921. We're here to help. Thank you, Dr. Sonny Aslam.
Thank you, George.
Inspiration for the Nation.